good evening. My name is Andrew Doan, and I want to tell you about something that happened in July of 2008. My family and I had just moved here from Central Ohio, and at the encouragement and urging of my sister-in-law, I, my wife Danielle, and our then 2.5-year-old son Eldon pulled into the parking lot here for our very first appointment at Spinal Corrective Center. Now, I have to tell you, I'm not the type of person that really relishes the idea of new and unfamiliar things, especially when it comes to meeting new and unfamiliar people in new and unfamiliar places. So I'll be honest, I was not very comfortable the very first time we came into this office. In fact, I remember telling Jessica at our new patient interview that I wasn't very comfortable. I don't know what she thought about that, but that's how I felt. You know, it's been 2.5 years, and I can tell you that after numerous appointments, regular adjustments, and a lot of conversations with the members here at Spinal Corrective Center, I would have to say that our time here has been very helpful, healthful, thought-provoking, and even fun. We have readjusted our thinking when it comes to some of the foods that we eat and don't eat. And we've readjusted our thinking as far as our view of sickness and allowing the body to do what it was designed to do. In addition to that, I would also say that we've formed some friendships that we cherish greatly and are very important to us. So in light of all that, it really is an honor and a privilege for me to be able to introduce to you one of the friends that I've made while I'm here at Spinal Corrective Center, and that is, of course, Dr. Jennifer Kretzinger. Dr. Jennifer is a health productivity expert, and she speaks regularly around the country. She's been in private practice as a doctor of chiropractic since 1996. She, along with her husband David, run the Spinal Corrective Center. As a leader in chiropractic, Dr. Jennifer has been a sought-after speaker at chiropractic seminars in colleges across the country. She and Dr. David run a doctor training seminar twice a month for New England chiropractors, and she's a member of the faculty at Life University in Atlanta, Georgia. She regularly puts out a professionally recorded podcast called For the Health of It, and she also has a wellness blog that she writes for regularly. She and Dr. David are the proud parents of Max, age 10, and Mackenzie, age 7. In her spare time, she enjoys taking dance classes and going camping with her family. Obviously, she's a very busy lady. You folks are very busy folks as well, so I'm not going to take any more of her time. Would you please join me in welcoming my chiropractor and my friend, Dr. Jennifer Kretzinger.
Thank you so much. Thank you, Andrew. How special to have someone who starts off as a patient in the office and, like he said, grow to be an important part of our practice. So I appreciate him introducing me. It wasn't that long ago that in the middle of the night, I heard a noise and little feet scampered into our bedroom. It was our 7-year-old daughter, Mackenzie, and she was asking for an adjustment in the middle of the night. So of course I said, "What, honey?" And right away I could tell that something was wrong. She felt hot. You could feel the heat coming off of her body, and she just said, "Mommy, I don't feel good. Could you please adjust me?" Well, unfortunately, I have the ability to do that. How cool that in the middle of the night I could adjust my child. So I did, and I said, "You'll heal, go back to bed," and went back to bed. And the next morning she woke up, and it was like nothing had ever happened. She was fine. And I said, "Mackenzie, do you remember coming into our bedroom in the middle of the night?" And she said, "Uh-huh." She goes, "I was getting sick. I just needed to be adjusted. My body healed." Do you think that's very common in our country? No. It's interesting. Even when you talk about children and healing, from a very young age, we're taught that there's something outside of us that's going to heal us. You know, think about it. If you have children, or you'll remember yourself, you would cut your finger and you would need what? Band-Aid. Right. And would you agree that most children would absolutely firmly believe that the Band-Aid itself would heal them? Mm-hmm. Yes. As if the Band-Aid had a magical healing power. So with our children, I would say to them, "Well, we'll give you a Band-Aid because the Band-Aid will help keep your finger clean so your body can heal it." That's the truth, right? But yet we don't often think of using that language. And for an impressionable child, that can make a huge difference in their belief system. Now let's take it one step further. It's very common that when we don't feel good, we elicit symptoms. Now stay with me for a minute. If your body has something inside of it it doesn't want, tainted food, a bug, a virus, it wants to get it out, right? If you think about all of the ways your body could expel what it doesn't want, think about all the holes in your body, seriously, right? You could get a rash on your skin, you could have something coming, tears coming out of your eyes, you could have seeping coming out of your ears, you certainly could have a runny nose, you could vomit, you could have bowel issues, you name it, you could have excessive sweating. If you really think about all of these symptoms, which oftentimes don't feel good, it's your body's way of healing you. It's your body's way of getting out what it doesn't want. Now let's talk about fevers. Now, would you agree that the average parent with a young child has a belief system, whether or not they've even thought to question it, has a belief system, the child has a fever, we have to bring the fever down. Right. As if the fever itself was the problem or the disease. Because you think about that, we often make the symptom the disease. Oh, well, I have a cold. Oh, I have a sore throat. I have a fever. Now let's think about this. When it comes to a fever, why do we get a fever? I know you know the answer. Why would we get a fever?
It's trying to kill something.
You think about it, your body's an amazing furnace. It doesn't want something. It heats up the temperature and literally burns it off. The fever is your body's attempt to cure from the problem. The fever is actually the cure of the disease. The symptoms are oftentimes not the problem or the disease, they're the cure of the disease. Now, if we think about that and we try to educate our children in that way, we might say something like, oh, excellent, you have a fever, that's great. It means your body's healing. That's good, you'll probably be well soon. Isn't that different? Oh, good, you're vomiting, your body is getting it out. Excellent, right. It doesn't feel good, I know. We should keep you home today. Okay, so when we're talking about kids, we can get that, right? We could put our head around that and see the value. What about us? I mean, who can remember the last time they said, oh, I feel terrible, but I have to go to the office anyway. I have to get this done. I have to do that. And you push through and you push through. You ignore that your body is screaming at you to stop, and you push through anyway. Do you think it takes longer or shorter to get well?
Longer.
Yeah, but yet we've been taught that, well, I can just take something and make the symptom go away. And you could. You could take a cough suppressant. You could even take Tylenol, Motrin. You could even take something over the counter, something that was prescribed to you. You might feel better, but is that the same thing as being healed? No, nothing outside of you can actually heal you. It can just give you the illusion through usually a toxin or a chemical, as in a pharmaceutical. It can give you the illusion that your body is healed, when in fact it's not. And that's when we start to see the recurrence. Wow, that cold lasted 2 weeks, and then I can't believe it's only been 5 days, and now I have the flu. And there's a cycle that happens when in fact the problems stem from the body never actually healed in the first place. Maybe it was given the illusion of health, but as soon as the body was put in front of chemicals again, put in front of environment, stress, lack of sleep, it got sick again. So the building of health requires, first of all, that we recognize a symptom is there to help us heal, and that we honor what the body needs us to do. Now, instead of getting up and pushing through it and going to work, what do you think the body really needed?
Rest.
Rest. So actually what I'm doing right now is I am giving you permission when you don't feel well to stay home and to rest. What's amazing about that is the resting and the allowing of the body to work through the symptom is the fastest way to heal. Now, we know what heals you then. We know that the body has the ability to heal you. Agreed? Mm-hmm. Okay. Now, why is it sometimes it doesn't, right? Sometimes it just doesn't. We can blame that reason almost all the time on the environment. And when I say environment, I mean the literal environment. Also, what you subject your body to, your level of stress, how you perceive and handle stress, the food you put into your body, the amount of strain you put your body through. That's what you can control, and that's what the factor is in healing you. But I'll tell you, this ability to heal, what heals you from a cut every single time you get that cut, it has a name. We're going to call it innate intelligence. Now, innate refers to inside, inborn. Chiropractic used the term innate intelligence for the first time back in the late 1800s. And there's a lot of names you can give to this inner intelligence. We'll use the word innate because I like how it suggests that we have the ability to heal the intelligence inside of us. I want to take some time right now and explore how we were created and allow us to put some awe back into our body's ability. Because I'll be honest with you, oftentimes the decision to disregard our body's healing ability comes from fear or lack of remembering that our bodies are capable. So we're going to reinvest some of our belief in what our bodies are able to do. Embryogenesis, you remember this? Maybe it was 8th grade or so, how a baby's made. Now, one of these guys gets lucky. And we start, right? How do they even know it's there? There's an intelligence from the beginning. We start with a process after fertilization. It's called differentiation and specialization. And I promise you these big words will have a point. Cells start to divide. This is what eventually will make a baby. So we have 2 cells, 4 cells, 8 cells, 16, 32, 64, and so on. Now, some of the cells go off and become the baby. Some cells go off and become the amniotic fluid, what the baby floats in, and some go off and become the placenta, or the food for the baby. Now, if you think about it, how do the cells know where to go? We're going to establish that there's an intelligence driving this process. Now, if innate intelligence could be personified, if it was an actual person inside the body directing all of these cells and it could talk, at about day 3 after fertilization, it would say, okay, we have way too many cells. We need to create some organization here. Let's develop the first system in the body. Does anybody know what the first system in the body is?
Nervous system.
You guys are so good. That's right. The nervous system, particularly the central nervous system, which is the brain and the spinal cord.